Let's talk transformations. This patient came in and he had a main complaint of laxity on and around the eyes. And of course, I talked to him about doing surgery first because for any patient who has an indication for a blepharoplasty, I always educate them on that and ask them if that's something that they want to do. And he said no. So we decided that we were going to go our non-surgical route and do the protocol that I had set up. And as you can see, his left side of the face was a little bit worse than the right side is in terms of the laxity that we're seeing in the skin. So what I decided to do was RF microneedling in specific areas. I wasn't doing it all over because he also does have volume loss and I don't want to worsen that. So I did RF microneedling along with a CO2 laser treatment to help with buffing out and smoothing the skin and then helping a lot with around the eye area. And here is the result for him 5 months after I started doing my protocol. And what you can see is a complete improvement in the area on both sides under the eyes, especially on the left side where he had it worse. And here's a little side by side for you guys to be able to appreciate what the actual change was that we're seeing. So when you go to his forehead, you're going to see that the deep set lines in the forehead are a lot more smoother and shallow. The skin also looks more even and it has a little bit more of a glow to it. Then we go down to the lower area and we're seeing a complete smoothing of the skin over there and tightening. Continue to go down and you start to see softening of his nasolabial folds that he has there. The important thing here is when you're coming into an aesthetics practice, there's going to be a certain amount of things that we can do and cannot do, and setting expectations is the important part here. And for a lot of my patients, if they need to go to a surgeon, I tell them that they need to go to a surgeon. And a lot of them choose to not because they don't want to go through downtime. They would rather just do whatever treatments we can do for them to help them get nearest to their goal. But truthfully, I ended up getting him past the goal that he had originally with me, and I'm extremely happy, but also so is he.